Hello, it's Dr. William Peltier at Peltier Family Chiropractic and Wellness Center. We're going to talk to you about the major interference that we chiropractors work with every day in our office. I'm going to backtrack a little bit, talk to you a little bit about, remind you what we talked about earlier, and that was that your nervous system is the thing that runs the program. It runs your body and every function of your body. In fact, if you look up in any anatomy book, any physiology book, it will tell you that the purpose of the brain and the nervous system is to control and coordinate the function of every cell, tissue, organ, and system in your body. What does that mean? That means that your respiratory system is controlled by your nervous system. Your cardiovascular system is controlled by your nervous system. Your digestive system is controlled by your nervous system. And we can go on and on and on with that. But your nervous system is the master controller. It controls everything. And we chiropractors, what we look for when we check people's spines is we look for what's known as a vertebral subluxation. And a vertebral subluxation is when a bone or several bones of the spine get injured, shift, heal improperly, and block that nerve flow. Okay? It's not allowing the brain then to communicate to the body the way it should. And as we talked about earlier in one discussion, is that it's going to lead to a malfunction. It has to, because the nervous system controls all function. Therefore, if it's interference to it, has to create a malfunction. Now, there's many different malfunctions and symptoms people deal with every day in our office that we see every day in our office. And I just want to share a few with you and associate them back to the spine so you understand when you have interference to these levels of the spine, it can cause these certain symptoms. Now, in the upper neck, when you have subluxations in that area, nerve interference, it can cause things like headaches, dizziness, lightheadedness, ear problems, eye problems, sinus problems, ear infections in children, just to name a few. The mid and lower part of your neck, those nerves go out to the shoulders, arms, hands, and fingers. So you have interference in that area, can cause things like tension across the shoulders, numbness and tingling in the hands and fingers, carpal tunnel syndrome, loss of grip strength, weakness of the arms. Those nerves also go to your thyroid and vocal cord area, which can lead to you having to clear your throat a lot, especially in the morning, difficulty swallowing, increased anxiety, problems around that time of the month for females with mood, behavior, cramping. Let's go down to this area, right through here. The nerves of this area of the spine, they go out and control your breathing and your stomach functions, and even nerve supply to your heart. And when you have interferences there, it can cause things like heart palpitations and arrhythmias. It can cause asthma, chest pressure pain, difficulty breathing. It can also cause acid reflux, indigestion, heartburn. Let's move down here to the lower part of the spine. The lower part of your spine, those nerves go out to your internal organs, your bowels, your bladder, even control your sexual functions as well. When you have interference in this area of the spine, it can cause things like constipation, diarrhea, rectal bleeding, if allowed to continue, irritable bowel syndrome, ulcerative colitis, Crohn's disease. It can also cause bladder incontinence. Those same nerves from the low back go down the legs, feet, and toes. So when you have interference with those nerves, it can cause things like cramping in the legs, restless leg. It can cause leg pain, leg numbness, knee problems, feet problems, neuropathy in the feet, just to name a few. So you can understand that when you have interference in the nervous system, it's going to lead to a malfunction, which can lead to any one of those symptoms I just mentioned to you and many, many more. Now, what's really interesting is that subluxation is often referred to as the silent killer. And what I mean by that is that you don't always know you have nerve interference. In fact, most of the time you don't. And we'll talk about that in another discussion. So that's the reason why you want to go see your chiropractor. You want to get your power turned on. And you want to make sure that you are subluxation free so your brain-body connection can be at its best so you can be at your best. See you next week. Have a fantastic week.